Today, we're focusing on women's health, specifically heart disease. According to the American Heart Association, heart disease is the leading cause of death in women who are over the age of 20, but it's also one of the most preventable. On today's show, we'll talk with obstetrician gynecologist Dr. Priya Sureddi Patel. We'll discuss how an OB-GYN plays an important role in a patient's heart health, as well as provide some preventative steps to reduce a woman's risk for heart disease. That's coming up next.
Welcome to the Wellbeing DFW podcast. Each week, Scott Sams will cover a different topic on improving health and well-being in our North Texas communities. He will host interviews with physicians on the medical staff of Texas Health Hospitals.
I'm Scott Sams. Thanks for joining us today. An OB-GYN plays an important role in a woman's health, from annual breast exams to pelvic exams. But they can also provide insight into something often overlooked: heart health. Many women may not know that there is a direct link between some women's health conditions and an increased risk for heart disease. That's why it's just as important during your annual Well Woman visit to discuss your heart health with your OB-GYN. Our guest today is Dr. Priya Sureddi Patel. She's an obstetrician gynecologist on the medical staff at Texas Health Presbyterian Hospital, Allen. She'll discuss, among other things, women's heart health and talk through those more uncommon OB-GYN-related conditions that could impact your heart health. Dr. Patel, thanks for joining us today.
Thank you. I'm so glad to be here.
First, let's talk about women and heart disease. What are some of the signs or symptoms that women may overlook in identifying their risk for heart disease?
Well, traditionally, cardiovascular disease has been thought of as a male's disease, and historically, the patient presenting with a heart attack was the 70-year-old male smoker. But despite the historical stereotypes, we have more and more evidence that suggests that heart disease is not only a leading killer in women, but also may present more silently, may be more likely to be dismissed, and may occur due to a variety of risk factors that extend beyond the traditional risk factors seen in men. Let's take risk factors, for example. In men, you have smoking, hypertension, hyperlipidemia, which are all important heart risk factors. However, in women, age at first menstrual cycle, your menopausal status, the number of pregnancies, your estrogen status, meaning if you're pre or postmenopausal, presence of conditions such as PCOS and other gynecological conditions that may be associated with hormonal imbalances, all have been shown to contribute to the processes that cause heart disease. These are not traditional risk factors, but important ones to consider in addition to the traditional cardiovascular risk factors like diabetes, hypertension, high cholesterol, etc. Secondly, as you said, the warning signs in women are often different. While men may present with the typical symptoms, women are more likely to present with atypical symptoms, perhaps arm numbness as opposed to the typical chest pain, or arm pain that may often be missed by practitioners. That brings me to perhaps the most important aspect of caring for cardiovascular disease in women, which is that recognizing their symptoms may be different, their risk factors may be different, and thus it is very important to not miss their presentation. Data suggests that women are more likely to be dismissed and their chest pain or arm pain more likely to be called musculoskeletal or anxiety-related when compared to their male counterparts. So your OB-GYN really plays an important role in not only recognizing risk factors and helping to prevent cardiovascular disease, but also in helping you to understand that should you have a heart attack, your symptoms may be different and atypical, but still should be taken very seriously.
During an annual visit, a patient gets blood work to help identify their risk for heart disease, like cholesterol, blood pressure, blood sugar, BMI. But family history also plays a role. Where does family history fall into predicting someone's risk for heart disease?
So it is always good to get baseline numbers and have an idea of where your cholesterol, blood pressure, blood sugar, and BMI are. Additionally, family history is important in predicting your cardiovascular disease risk. Women should always tell their OB-GYNs about any early history of heart attacks, any sudden deaths in the family, any history of brain aneurysms, or the like that may have occurred in themselves or any family members.
Even if women have a primary care provider that they see regularly, is it still helpful for them to discuss their heart health and their history with their OB-GYN? And if so, why?
Absolutely. The more people you discuss these things with, the more likely that someone is actually to catch something that someone else may have missed. You should view your doctors as a healthcare team that work together to try to give you the healthiest you. So ultimately, the more providers that you can discuss something with, the better.
Are there any heart conditions that pose a higher risk for women who are thinking about getting pregnant?
Yes, there are several conditions that are important to consider where you would need further counseling prior to conceiving. If you have pulmonary hypertension, any sort of congenital heart disease, if you have a history of a coronary artery dissection or any kind of valvular heart disease, or any history of cardiomyopathies. All of these would put individuals in a higher risk once they do get pregnant. So you would really want to get preconception counseling and talk to your doctor prior to getting pregnant.
So then what role does pregnancy have on someone's heart health?
If you have any of these medical conditions, it would certainly oftentimes can worsen them. So it's really important to make sure that those conditions are optimized prior to getting pregnant to minimize any risks to mom and baby during the pregnancy.
Are there any other health conditions that women should know about that can potentially increase their risk for heart disease later in life?
Yes, absolutely. The presence of gestational diabetes, hypertension, or preeclampsia in the pregnancy can be markers for future diabetes, hypertension, and heart disease. These conditions during pregnancy actually suggest a predisposition for these conditions later in life. While they typically will resolve with delivery of the baby, the predisposition remains and presents itself later in life unless patients are treated with aggressive diet and lifestyle modification. Should women who have these cardiovascular risk factors, such as preeclampsia, hypertension in the pregnancy, or gestational diabetes, address these risk factors early and follow a dedicated diet and lifestyle program to lose weight, there is a higher chance that they will decrease the likelihood of these conditions occurring in the future.
And there has also been some research about the link between certain gynecological conditions and heart disease, such as PCOS, endometriosis. Why do these conditions potentially increase a woman's risk for heart disease in the future?
So these conditions have to do with hormonal imbalances that predispose individuals to the acceleration of the atherosclerotic process, which is basically the process where you have clotting in the blood vessels. And so that is what results in premature coronary artery disease and heart disease.
Are there any preventative measures women can take to reduce the risk for heart disease or better assess that risk if they have or have experienced any of these gynecological or pregnancy-related conditions?
Absolutely. Recognition of these risks and appropriate screening with blood work may be helpful in identifying disease early. But most importantly, these patients should aim to maintain a low to normal BMI, eat healthy, and always exercise routinely. With reduced BMI, other metabolic parameters such as sugar levels and lipid levels or cholesterol will naturally improve, which will reduce the woman's overall risk for heart disease.
And last but not least, what lifestyle changes do you recommend for women who may be at risk for heart disease?
So I generally recommend that all women, not only those at risk for heart disease, exercise about 30 to 40 minutes at least 4 to 5 times per week. Ideally, incorporating high-intensity intervals during this has been proven to be beneficial for preventing heart disease. Secondly, I advise the Mediterranean diet or a plant-based diet to help maintain a calorie-restricted but nutrient-rich meal plan, which will help in maintaining a normal weight. Lastly, I recommend considering initiation of a statin as needed if cholesterol levels are elevated, and discussing the risks and benefits of hormonal replacement therapy with both your OB-GYN as well as your primary care provider and possibly a cardiologist if you have one.
And that'll do it for today. I'd like to thank Dr. Patel for joining us. We do appreciate you being here.
Thanks so much for having me.
Texas Health is partnering with you for a better North Texas. To hear more Wellbeing DFW podcasts, visit our website at texashealth.org/podcast. I'm Scott Sams. Thanks for joining us.